Tasha Jones, and I'm going to do an IM injection. I have my partner here, and I'm going to show the IM injection sites. Firstly, I'm going to show the deltoid muscle. To locate the deltoid muscle, you would locate the patient's acromion process, which is right here, and you would go 2 to 3 finger widths down from the acromion process. So I'm 2 finger widths down right now. You'll make a V, and the deltoid muscle is going right here in the inside of that imaginary V. The maximum amount of medication that can be given in the deltoid muscle is 1 ml per deltoid muscle. I'm also going to show the vastus lateralis. You would first locate the patient's greater trochanter, which is right here, locate the patella, which is also called the knee, and you would divide it into thirds. And the vastus lateralis is the mid-lateral section of the thigh, which would be about right here. You would inject it, and you can give in between 2 to 3 ml of medication on the vastus lateralis. The third site that I'm going to show is the ventral gluteal. To locate the ventral gluteal, you're going to find the patient's greater trochanter. You're going to find it, and you're going to place your thumb on the patient's greater trochanter, which is right here. My thumb should be facing the patient's umbilicus. It is. The index finger should be facing the anterior superior iliac spine. Gonna feel it right here. My middle finger should be facing her head, and it should also touch the iliac crest. The injection site is right here, and you can give in between 2 to 3 ml of medication on that injection site. Thank you, Melissa. Now I'm going to go ahead and give the injection. To start, I have my medication I have my drug guidebook, just in case I have to look up the medication. I have my doctor's order, which will be my MAR, and it states that I am to administer vitamin B12, 1 milligram IM every month. I have my medication here. In the bottle, it comes in B12, but it comes in 1,000 micrograms per ml. I've done my dosage calculation, and that means I will pull out 1 ml of medication in order to get the 1 milligram that's needed to inject my patient, because it's 1,000 micrograms per ml. I have my needle. I have a 1-inch needle, and I have my needle here. Because it's an IM injection, you want to give in between a 1-inch or a 1-inch needle, depending on the size of the patient. I have a 1-inch needle here. B12, I looked it up in the dosage guide. It's not irritating to the skin, so you don't have to give it VTRAC method. You can give it regular IM. So before I get started, I want to go ahead and state the 6 rights of med administration again. You need to make sure you have the right patient, the right drug, the right dose, the right time, the right route, which in this case is IM, and the right documentation, and the patient also has the right to refuse. So to start, I'm going to go ahead and do my first medication check. Have the B12, 1,000 micrograms, which I will pull out 1 ml. It's right. I'm checking against my MAR. It's correct. So I'm just going to go ahead and prepare to give my injection. I'm going to be using this to give the injection. So before I start, I'm going to go ahead and open up my needle, and I'm going to pull back 1 ml of sterile air while it's still in the container. This is a brand new vial, a bottle, multi-use bottle of medication. It's not expired. The expiration date is December 1st, 2015. So it's good. There's no particles, and I can go ahead and use it. And again, I've already checked it against my MAR, so I can use this. I'm going to go ahead and open it up. Since it's brand new, I do not have to sterilize the top of the vial because it's unopened. I'm going to go ahead and put my medication in, put the air in, and withdraw my medication out. Again, I should have 1 milliliter of the B12. Getting out any air bubbles here. recapping safely, I have exactly 1 ml of the B12 medication. Second medication check, I would compare the 1 ml against my MAR of the B12 medication. It is. That's complete. Right before I give the medication to the patient, I'll go ahead and change out the needle so that I have a nice and sharp needle when I'm giving it to the patient. I have a new 1-inch needle. When I'm going into the patient's room, I'll knock on the door, foam in, and do hand hygiene before I touch the patient. I'll verify the patient's name and date of birth. Verify the patient's name and date of birth. So to stimulate, I'll go ahead and take this in with me, take my medication and take my MAR. Knock, knock.
Come in.
Hello. As I'm going in, I'll go ahead and close the curtain from hand hygiene. Hello, my name is Latasha. I'm a student with the College of Central Florida. Can you tell me your name and date of birth?
Joan Jane, Miss Gladys Jones, 7588.
Thank you, Miss Jones. And the name and date of birth matches with my orders. Now, Miss Jones, I do have an order for the doctor to give you a shot of B12 of the B12 vitamin B12, which is going to help supply that vitamin that you're deficient in. Now, do you have any allergies?
No.
Have you ever had the injection before?
Yes.
Okay, so good. Is there a particular site that you want me to give it in? Is it okay if I give it into you in your thigh?
That's fine.
Okay. So I've chosen the site that I'll give it to with the patient. For the purposes of the video, I won't use the real mannequin. I'll go ahead and use the gel pad. But again, I'll perform a hand hygiene. This is still sterile. I'll go ahead and grab some gloves. Don't have any here. Normally, if I didn't have any here in the room, I would get some gloves from out of the room. Since I didn't have any with me, I'm just going to grab some gloves now. I have my gloves on. I have an alcohol wipe, swab. And I'm just going to act like this is the patient's vastus lateralis and inject the medication. And before I clean the patient, I'll do a third medication check. Make sure that I have the 1 ml of B12 medication going to the right patient, right time, and right route, which I do. And I'll go ahead and get ready to give my injection, have on my gloves. Go ahead and scrub the injection site. I'll allow it time to dry. Once it's dry, I'll go ahead and hold the skin taut. Go in at a 90-degree angle. I'll hold the needle down to secure it. I'll aspirate. I don't see any blood. And I'm going to go ahead and give it all. Pull out. There's no blood. She's not bleeding. If she was bleeding, I would maybe apply a little pressure and add a Band-Aid. Needle is recapped. Take this out and put it in the sharps container. Throw my gloves away. Is there anything I can get for you, Mrs. Jones?
Nope.
Okay. Call light is in reach. I'll come back to check on you in about 15 minutes or so, okay? You may have a little pain at the injection site, okay?
Okay.
Alrighty. Put the overbed table back. Open up the curtains. And go ahead and foam out my hands before I leave here. Here's my hands. And I'm going to discard this in the sharps container. I'll open up the curtains and document.